Hi, my name is Dr. Ami Dakshini and I'm a dermatologist. So, acne vulgaris is a very common condition. Whether you're 16 or 36, it knows no age. Let us sit and talk together about what is the difference between teen acne and adult acne, and when should we take treatment, and when should we go and meet our dermatologist. So, acne in teens is generally due to change in hormone. Puberty brings out these hormones in the body, which then increase the sebum or the oil production in our skin. The face has maximum oil glands, so you start noticing more changes on the face, sometimes on the back and the chest. You notice that these cells, which are thicker, drier in teens, they tend to block the pores with excess oil production that then forms a comedone, which subsequently can get inflamed to cause acne vulgaris. In teens, generally, the acne are noticed on the forehead, on the nose, as well as the cheeks. It could be associated with dandruff and also due to certain lifestyle changes like excessive sugar intake and sometimes in case of excess dairy. So, in adults, typically acne is seen after the age of 25 and generally due to hormonal changes. Now, here it's because of excess hormones and not just a spurt in hormones like in teens. So, commonly seen in cases of PCOS, where the ovaries have cysts and they produce excess of estrogen and or progesterone, causing excess oil production and thereby acne. It could also happen just when there is either ovulation or when the menstruation is starting again because of changes in these hormones. Sometimes in adult acne, we can see due to poor hygiene habits. While you're using excess makeup and you do not remove it at night, or if you're using excessive occlusive treatment in your skincare routine. Stress is one of the bigger factors causing acne in adults because with rise in cortisol hormone, it can also increase in inflammation as well as increase oil production in the skin, leading to acne. And in adult acne, commonly the acne is limited to the jawline, the upper neck. Very rarely it affects the cheeks. So this can give us an indication of the cause of acne, and thereby accordingly we can treat the patient. OTC products now contain a lot of actives in India. Here today we are talking about benzoyl peroxide and salicylic acid. Now, benzoyl peroxide is generally present as 2.5 or 5%. But how does it act? Benzoyl peroxide is a bacteriostatic. So the C. acne, which cause acne, the bacterium, is reduced in the skin because it reduces or kills this bacteria. Second, it also reduces inflammation. So, for red, inflamed acne, benzoyl peroxide helps in soothing the skin. But we need to understand that this also increases exfoliation. So, at times, it can be irritating, it can dry the skin, cause a lot of redness, and make the skin more sensitive. So, the right usage and the right percentage of benzoyl peroxide is important. If you're starting for the first time, step it up slowly and then start using from 2.5% going to 5%. The other advantage of benzoyl peroxide is that it's excellent for truncal acne like your chest and your back. Preferably use it at night, and it has this bleaching property. So use lighter clothing because it can bleach darker colored clothing. When it comes to salicylic acid is nothing but a beta hydroxy acid which is oil soluble. So the advantage here over alpha hydroxy acids is that it can dissolve and enter the oil glands. It can cleanse the pores so that the clogging can reduce. Therefore, salicylic acid in a percentage of 0.5 to 2% is generally used as a cleanser or as a serum, which can help remove the clogging of pores and can be used when there are whiteheads, blackheads, and early acne. But either of these, remember, do not use it over a long period of time, and do not use if your skin is dry, itchy, or red. So while these OTC products containing benzoyl peroxide, salicylic acid, niacinamide are great in reducing the acne, sometimes it's very essential to understand the cause of acne. Only then the treatment is long standing. That's the time when you need to go and meet a dermatologist. Generally, these creams, which are over the counter, take about 6 to 8 weeks to start acting. But post those 8 weeks, if you do not see a resolution, it's better to meet your dermatologist. Next is when you notice that your acne are increasing, they are becoming cystic or nodular, or they are extremely painful. it's time to meet your doctor. Also, when these acne heal with a dark mark or with a depressed scar, it's time to meet your dermatologist. The next important thing that you need to remember, you need to meet your dermat, is after using your OTC products, you notice that your skin has become extremely sensitive. It burns even when you apply water or very basic ingredients. That's the time you've overused your OTC products and you need to go and consult your dermatologist. So, what is the best skincare routine for such skin types? Remember, less is more and gentle is our protocol. For day care, remember to use a very gentle cleanser or maybe something containing salicylic acid up to 1%. Over that, don't forget to moisturize your skin. It's important to keep your skin hydrated and moisturized. Otherwise, there is rebound oiliness if the brain considers the skin dry. So use moisturizers which are light, either containing ceramides or squalane. Over that, don't forget to use a sunscreen, preferably a medicated sunscreen containing zinc oxide because zinc itself can reduce acne. At night, remember to double cleanse, especially if you're using makeup, because even if a bit of your makeup stays back, it can clog your pores and cause pimples. After double cleansing, use a little thicker moisturizer so that it can prevent transepidermal water loss and the skin can remain hydrated. Over which, use your actives, either your benzoyl peroxides or your azelaic acid or your retinols, depending on what you're using and what has been recommended to you. Some important tips are: do not scrub when you are using these actives or exfoliants. Keep your skin lighter and hydrated. Avoid using alcohol based toners and wipes, especially if you notice that the skin has red or inflamed acne. So, we all understand that skin is a part of the body and it's dynamic. What you eat, what you think, how you take care of yourself is going to be reflected on your skin. So, yes, diet and stress can aggravate and trigger acne. Now, what should you look out for? The first is high glycemic foods like your white breads, sugary foods, foods which are processed and preserved. All of them can increase the glycemic index, increasing inflammation and causing acne. The next is dairy. Not in everybody, but it's important for you to keep a note that milk, especially milk derived from animal sources, can cause acne. Skim milk, which contains whey, is also another cause of acne. So, if you're taking whey proteins or skim milk, please avoid that and see if your acne is improving. It's good to keep a food diary so that you can check the trigger and accordingly omit that kind of food that aggravates acne. And stress, of course, causes acne because stress increases a hormone called cortisol. Now, this cortisol hormone can further increase a lot other hormones in the body, which subsequently cause inflammation and blocking of your pores, including increase in sebum production. All of this is a great mix to cause acne. So, stress, yes, will cause acne. So, learn measures in which you can de stress and you can help yourself out, reducing the inflammation in your body and thereby reducing acne flare ups.